Go ahead.
Welcome, everyone. This is Ywca Wiggins. I'm Executive Director of AFCPE, and I'm really thankful that you all decided to join us today as we take a deeper dive into the COVID-19 pandemic from a racial and gender lens. For those of you who may be on the webinar who aren't as familiar with AFCPE, we are a national nonprofit association that certifies and supports financial counselors, coaches, and educators. We know that people were struggling well before COVID-19 hit, and we were facing huge disparities in terms of income and wealth inequality across race and gender. And I really think this is one of the reasons that AFCPE professionals are so uniquely equipped to grapple with and help solve some of these bigger societal struggles. Because you're not only highly trained experts in personal finance topics, but you also bring this incredible empathy and compassion to your work and to the people that you serve. And I believe that's actually what's it's going to take to get to the heart of these issues and work towards meaningful solutions. So I thank all of you for your courage and your commitment to this work and for taking the time to join us today. I'm incredibly grateful to our exceptional panel for sharing their wisdom and perspectives from the field. And I'm going to skip bios today just for time, but we did put them up on the website for you as well if you want to dig in a little bit more to each of their backgrounds. On the call today as part of our panel, we have Christy Angel, who's the president and CEO of the Ywca Columbus. We have Liz Brown with us, who's the president pro tem of Columbus City Council and executive director of the Ohio Women's Public Policy Network. Kelly Griesmer, who's the president and CEO of the Women's Fund of Central Ohio, and Michael Thomas, who's a very own accredited financial counselor. He is also a professor at University of Georgia. And I have to say, Michael has an amazing TED Talk on financial empathy. And I think to date is the only person who's ever given had a standing ovation at our keynote as a keynote speaker for one of our conference sessions. And so we really wanted him to be here today to sort of also talk from that lens of a practitioner. So I know we only have a little bit of time with Liz today. So I thought what we'd do is actually kind of jump to what I would typically do at the end, which is focus a little bit more on public policy, maybe how we can think about restructuring the way the system is set up. And I wanted to give you a little bit of time before I know you've got to jump off. So not to rush things, but I wanted to jump right into that and start digging in. So Liz, I'd love to get your perspective right off the bat on sort of how you see how you think we could restructure policy moving forward, and any tips that you have really for the financial professionals in how to address some of these issues of inequality.
Absolutely. Thank you. Thank you, Ywca, for inviting me and for hosting this forum. It's really great to know that folks of your background and caliber are putting their heads together to try to solve what we're really, I see we're at the beginning of the wave, not at the crest of the wave of the economic crisis that's facing us as aftermath to COVID-19. And my apologies too, as you mentioned, I'll only be joining for the very first portion of today's event. I'm going to go ahead and give my email address so that if anyone has follow-up questions about some of the policy level things that I dive into, I'd be happy to entertain them afterwards, since I won't be able to stick around for questions. And that email address is ecbrown, E and then C as in Clark, Brown @columbus.gov. So to your question, Ywca, I could not agree more that the challenges that we're facing in the economic effects of the COVID-19 crisis are in part outgrowths of the inequality that was growing pre-COVID-19. The challenges that a majority of Americans are now enduring, things like limited childcare options, fear for safety, limited access to food, navigating complicated government assistance programs. These are daily vulnerabilities long experienced by millions of workers, and they will only continue to present challenges. At the start of the COVID-19 crisis, some of the good actions that were taken by government were in the initial packages passed by Congress to try to put a marker in for paid sick leave for workers and try to put a marker in for paid family leave for workers. Unfortunately, as Congress is especially a Republican-controlled Congress, too often does, they created limitations around those benefits. So 25% of workers don't have access to paid sick leave in normal times. Those numbers are much higher when you're talking about hourly and low wage workers, the very same workers that in many cases are on the front lines of this crisis, working in takeout kitchens, working as delivery drivers, domestic workers, childcare providers and teachers, grocery store clerks. These are the same workers that often are afforded no sick leave. What the federal bill did is allow some workers access, but actually it left out companies with more than 500 employees and companies with fewer than 50. They did the same thing for paid family leave, allowing parents to take time if they need to care for their dependent children who don't have options during a time of daycare and school closures. But again, they left out employees at companies of more than 500 employees or fewer than 50. And that's the majority of the American workforce. So while we've seen some progress indicating that these family supports, which are especially important for women, were initiated, it's really on the rest of us to push to plug those holes in the safety net, because we have not gotten our arms around the health crisis and the immediate needs in protecting workers' health and protecting workers' ability to care for their family is crucial. So eventually restarting and recovering from the crisis will require us to recognize that an economy is only as strong as its workers. And that many workers who were struggling long before COVID-19, it's really due to these issues of financial health. So I'm going to talk a little bit about Columbus because that's my specialty. According to the Urban Institute, 57% of Columbus families are financially insecure. And how they're qualifying that is families with less than $2,000 in savings. 42% of residents in our city have subprime credit scores. So issues of financial security are particularly pronounced for women and women of color in Columbus and nationwide. Women are nearly half of the working population, but their wages are often the sole support for their families, especially at the lower end of the economic spectrum. 41% of mothers are sole or primary breadwinners for their families, earning at least half of their total household income, if not the full amount. So with that in mind, the problems become immediately apparent, from the gender wage gap to the overrepresentation of women in minimum wage jobs, from our high eviction rates, which disproportionately affect African American women, to the importance of single mothers raising families. It's no surprise that the stakes are high for all of us to do more. The problems that face women don't just imperil women, they imperil families and thereby imperil whole communities. In Columbus, we are working with community partners to support financial empowerment and education opportunities. And this was, I want to touch on an initiative that was pre-COVID and also talk a little bit about the federal money in the 2 minutes I have left so that I don't take up too much time, that we were allocated by the federal government. So first, the city received federal CARES Act funding. And immediately, we were dispersed the funds a couple weeks ago, and immediately we allocated $3 million in rental assistance for families, knowing the dangers that evictions pose for the long-term financial health of principally women and African American women. That $3 million went towards funding for legal aid to provide representation for residents in eviction proceedings, a civil legal proceeding with huge implications, but which families rarely have representation. Funding for community mediation services for housing stability and homelessness prevention. And then the vast majority, $2.65 million of that funding, went to impact community action to provide direct rent payment assistance. This kind of work to particularly get into the housing market and stem the problems there first of all, that housing should be a human right, and it's really something as policymakers we have to focus on, dig deep, and understand how to support people's longevity in their homes and their security in their homes. That's got to be, I think, one of our primary focuses in terms of policy solutions. And then additionally, we need to look at how our communities, and I think this is good work for local government, can better support financial empowerment for women. So last year, I partnered with the Columbus Women's Commission to apply for and receive a grant from the Cities for Financial Empowerment Fund. So this fund is being used to create a financial roadmap, essentially, for women and families. The goal is to build on the services that are currently available from community partners to strengthen credit scores, improve access to credit and banking services, and to provide household budgeting assistance. So that work was happening pre-COVID. It is doubly important now. And I believe, I actually think that Christy was in our initial meeting on this financial empowerment work last year. Christy was the voice in the room who reminded us that while we're working on individual counseling, individual change, we have to be working the systemic side as well. Individuals didn't get themselves into these problems, systems did, especially when you're talking about racism within the financial system. And that's why, while we do the grant work with the Cities for Financial Empowerment Fund, we cannot let our foot off the gas on these larger issues like housing stability, like access to childcare, like better wages for workers. And we have to keep an eye on this because women are being hardest hit by COVID-19. Women now have the highest unemployment rate they've ever had since the Bureau of Labor Statistics has been tracking these numbers by gender. They also have the highest workforce participation rate pre-COVID. So women have been affected greatly by layoffs, and women are often primary caregivers. I also want to point out, and I know that Kelly probably will talk about this because the Women's Fund has done such incredible work on the gender wage gap. But if you kind of think this through to the end of the paragraph, some of these trends that we're seeing right now, I'm worried about the ways in which the gender wage gap will become wider and more stubborn if we don't get under control the economic cliff that women find themselves approaching in the COVID-19 crisis. Women who are vulnerable to start and really need our collective focus now to support. So thank you for the opportunity to come on and talk about some of our efforts. We have a lot of work to do. And again, I'm just thrilled that financial professionals with your experience are coming together to put your heads together on the topic.
Thanks so much, Liz. And we will include a link for your email as well. So if anyone has questions about policy or any of the things that Liz shared with us today, you can certainly get in touch. And I know we have people all over the country, but a lot of these things are applicable in different areas, and the stats are really similar across the country. So thanks so much for sharing what we're doing here locally and what we should all be thinking about from a national perspective as well. Thanks, Liz. So I know Liz has to jump off, but I wanted to kind of go back, I guess, kind of to the beginning and sort of get your perspectives. I'll start really with Christy and then would love to hear your thoughts, Kelly and Michael, just kind of from your specific lens and what you do in your various roles, how you see this pandemic has further exacerbated the gender and racial wealth gap. And if you want to share a little bit, any information you have kind of like pre-COVID and then what you're seeing now and any different changes or how anything has, as I said, exacerbated the issue, I'd love to hear your perspective on that. Let's start with Christy.
Sure. Thank you, Rebecca, and thank you for inviting me to this important conversation. I'm hopeful that this is the first of many, and I'm hopeful that this becomes a way forward for us to really work together on the action steps that we need to take to start to close the wealth gap, because so many things have been laid bare with COVID-19. I think that it kind of gives us a path, really a work plan of the things that we need to do going forward, things that we knew we needed to do, but I think there's urgency around them because all of the vulnerabilities and the gaps really have been exposed, I think, with this pandemic. If there's a bright light out of this whole thing, or some good, maybe it's that it's a bit of a call to action. Ywca Columbus, I know this is a national conversation, and many of you may have YWCAs in your state or your city. Ywca Columbus provides housing services, leadership development, and education work in the community, including childcare. And then, of course, we serve as a social justice and advocacy organization in the Columbus and Franklin County area. So our housing programs in particular, and our child care and educational programs are the four programs really, or the two programs that we saw immediate impact with COVID. And what I mean by that is, we saw it in two different ways. When schools shut down on March 12th, our agency immediately started hemorrhaging money because our social enterprise is before and after school care in 2 suburban districts. And that is also a service to those communities in those districts. And we had to close those programs because they are delivered in schools. And of course, childcare was subsequently shut down as well. And then we run housing programs, permanent supportive housing and housing shelter services for homeless families. And so immediately we were faced with delivering our services in the worst possible scenario, which is a congregate setting in the shelter. And we were already in an overcrowded situation because of our perfect storm of housing instability here in Columbus and Franklin County, which really means that many families are housing burdened because of the high cost of rent and a lack of affordability and availability of units. We at that time had about 65 families in shelter, which 65 families doesn't sound like a lot, but you think of families, that's at least 2 people. So in most instances, it's 3, 4, and 5 people. So we had about 343 people in shelter as this pandemic hit. 73% of those families are African American in particular. No other minority, they were African American. And so, quickly as an agency, we had to start preparing for, life in a congregate setting and how you keep people safe and healthy and active. How do you keep children who need to distance learn? How do you help them learn? How do you help their families, educate them while living in a shelter? And oh, by the way, at the same time, many of those families, because they are deemed essential, those families, they were still working. They work in fast food restaurants, they work in grocery stores, they work in hospitals, and on some of the hospital staff, nursing assistants and things like that. 45% of our family heads of household work. And so we were also faced with what to do with the children during that time. So we were able to get a pandemic child care license in our child care center. We flipped that center. We have an amazing team. They're very agile, very nimble, and they quickly instituted all the protocols that now all the non-essential businesses are learning about. We implemented those on or before April 1st. So we started wearing masks, started gathering PPE, instituted 4 times a day cleaning, stopped volunteers and other entrants into all of our buildings. We did all of that very, very quickly. But what we have seen is this. Families, when we had about a 47-day average of families in shelter, families are finding it more and more difficult to get out of shelter because, it's difficult to find a place in the face of a pandemic and look for housing. Affordability still is not attainable during this time. Those that lost jobs, now they are back in the job search because they, lost their jobs. And then those who are able to continue to work, we did see about 11% of our families were able to move on very quickly those who were continuing to work, they were able to get units and move out of shelter. I will say that we're part of a larger housing system, and our system leader, the Community Shelter Board, worked with us very quickly to ensure that we could, beyond all the protocols and all the things that we had to stand up, that we could do what we needed to do to offer rent assistance and those other supports to families to quickly move them out of housing. But what we did see of the 11%, that you were more likely to see white families get housing before Black families got housing. And we know in this community that there is some racism. We're experiencing that at the rental market. And yet we haven't had the resources to do the testing and some of the things that we need to do to really, get the data so we can kind of go after those landlords who are preying upon, people of color. And during this time, we were able to drop our ratios in shelter down to a more manageable level, so that, if we have someone who becomes ill, a family that becomes ill, we can quarantine them before moving them on into a sick and quarantine shelter. As you can imagine, all other types of programs, like any other nonprofit, we've had to be nimble, we've had to shut down, we've had to come up with virtual programming and the like. But what I will say is this: in particular, in a state where African Americans are 13% of the population, yet we are 25% of the COVID cases, and we're 17% of the deaths. And when people hear that, and they hear, the alarming number, because it is alarming when you think about your 13% of the state, your 25% of the positive COVID cases, everyone is asking, why is that? And that is because of the foundation in which our systems, all of them are built on the system of racism, right? Compounded year over year over year on one another without really taking a look at, those systems and kind of dismantling them and trying to dismantle some of the racist, policies that existed. They go way, way back before any of us were even, thought of. And in that instance, in particular, there's a documented bias in treatment and in care, and there are higher environmental rates for African Americans and minorities in particular in the health system. And so if you are, working deemed essential, if you feel ill, and you're an hourly worker, and you need that money to go and be put on the table so that you can keep your housing, keep your child care, keep the things that you need to keep in place to keep your family stable, you're unlikely to not go to work because you have a cough, or you may run a low-grade fever of some of those things. And so what we're seeing is, people who continue to go to work, and then possibly, the spread continues, but also not have access to good quality health care because they've never had a primary care physician, or they're relying on clinics and some of those other things to get them through to take care of their health care, or they only go to the doctor when they're really, really very, very, very sick. And so we're disproportionately seeing people of color impacted, and people of color, because of the environmental stressors and the stress of racism. Think about the stressors. If you are George Floyd's family, or you are George Floyd, think about the stress of just, driving down the street and being stopped by the police, and then being handcuffed, and then having someone, and I know that I'm bringing up a, very recent news story, but the stress of that and what that does to a community is additive to the health of that community. And so, and beyond that, African Americans are more likely to have asthma, or higher percentages of African Americans have, asthma, high blood pressure, and diabetes. And, we've heard our Surgeon General, who I can't believe he said this, but, he said things like, well, they should just, eat better and stop drinking alcohol. It's like, no, that's not the answer. The answer is, better quality healthcare that's affordable, that's consistent, that's equitable, that removes some of the biases, that are in our healthcare system, so that everyone can receive treatment. So that if I go to the doctor and Kelly goes to the doctor and we both have a dry cough, that we both get a COVID test, not Kelly get a COVID test and I don't get a COVID test, or I have to wait 3 days and come back, those kinds of things. And we are seeing that play out. We saw that play out in our permanent supportive housing when we tried to get a COVID test for 3 of our residents. And these women who also have, diminished mental health capacity, and they need an advocate to act on their behalf, we saw outrageous things as this COVID-19 pandemic was playing out. We saw doctors give care that was unconscionable, that I would never stand for. And we had to call the public health commissioner, and thank goodness that we have that kind of relationship, to order a test for a woman. We had to then, have a conversation we actually had a conversation with Ohio Health and the hospital, Grant Hospital, about the care and the treatment that they were giving this woman, because they were just dismissing her claims of diminished lung capacity and those kinds of things. And we saw it play out in 2 other occasions. We've now, I'd say, changed that conversation, because we had strident discussions with leaders of health systems. And we see ourselves as that agency that has to stand in the gap, so to speak, for those that we serve, not just for those 3 individuals really, but for all people of color, to make, to have our health system leaders and those that work with them understand that, you can't give this disparate treatment just because you think someone may not have health care, or maybe this person, has some mental challenges and doesn't really, they feel okay, and they're just trying to, get something from the hospital, whether it's pain medication or what have you, whatever it is that they thought, as they shared with us, it was like they needed the COVID test. Now, they were negative, and that was a positive outcome, but it's that fast reaction that has allowed us to keep everyone safe in our particular buildings, and then tell the story and advocate for change at the highest level in this community, so that we can get those systems, those are 1-by-1 situations, but we really are trying to also have conversations about the systems that really are dividing people, keeping people back, and bringing this bias. And they keep, these systems are keeping people, they stand in the margins, they continue to stand in the margins. So we see ourselves as that advocate for those in this community. And lastly, I'll just say, before we started this call, Kelly and I were having a conversation about childcare. And childcare in this state has been the last to come back online. So, as well as I think our governor and our public health director have done in this community, we opened businesses, we opened, bowling alleys and hair salons and nail salons before we ever just discussed opening childcare. And how are women and families going to get back to work without adequate childcare? And while I know, and we made this plea through our advocacy collaboration to the governor's office, we understand that it's difficult. But we also understand that there was no one talking to our governor who ran a childcare business. Often childcare businesses are also run by women. And so the slap in the face to women that, one, we need childcare so we can go back to work. Many of us were already working, and we had solutions that were, not going to be viable much longer. And then to not invite childcare business owners and leaders to the table to figure out how to deliver the service, when most of us, those are women-owned businesses, just felt like we didn't matter, and that we were just, we'll get to it when we get to it. And still, we are trying to get answers around the $60 million of CARES funds that need to be distributed to childcare workers, because they are losing money and hemorrhaging money. And in our state, 50% of our child care agencies and businesses may never come back from COVID. And so what that means is quality child care for all people is going to be very difficult to find. And those that really can afford it will be able to afford it. And those that cannot afford it will have to, suffer and look for child care that may or may not be quality and meet their standards.
Yeah, thank you, Christy. And even just from what Liz was saying too, play that out till the end of the paragraph, as she said, to think about what those implications are for all of us from an economic and societal perspective. So thank you so much for your thoughts on that. You brought up something else that I do want to jump to, and maybe Kelly and Michael, you can jump in here. You talked a little bit about the misconceptions, the bias that is underlining a lot of I think from an individual and a systemic perspective, right? And so I'm wondering, what are some of those, particularly as you're seeing them from this pandemic? And Kelly, I know you've recently been talking about it being coined this she session. Mm-hmm. Did I say that right? I always say this wrong. Yes. Yeah. It's kind of a tongue twister, but so, kind of thinking about it in that way, what are those sort of preconceived notions that we have either from a gender or racial perspective or both? And how is that playing out as you're looking at the work that you do?
Yeah, so thank you so much. And I can share a little bit. The Women's Fund has been focused for nearly 20 years in the Central Ohio region on how to transform the lives of women and girls, and trying to figure out why they don't reach their full potential in our lives and our economy, importantly. And the reason is it's very simple in a lot of ways. To Christy's point, and I'm sure all the panelists would say, society wasn't built with women's experiences in mind, nor was it built with people of color's experiences in mind. And when you hit the intersection of women and women of color and their experience, we most certainly haven't thought about them. And that is not a problem that this generation on this call today caused, but we are absolutely called to action now to no longer ignore it. Because we have wasted every other crisis that's happened in this country by fixing things until the crisis is over, or noticing or feeling perspective or thinking about others' experiences. And then the minute we go back to normal, we pretend that we recover what was broken. We recover what was broken. This is not about recovery. This is about rebuild. We cannot waste this crisis and just recover systems that have never worked, for all the reasons that Christy has stated and so eloquently, and all the things that Liz said. And working with women, we do sit in the crux of it, because I can assure you that people have never thought about women's experiences, let alone the intersection of women and women of color. And certainly race across the board is a problem. But we do see that when you bring gender into this, to Christy's point, we talk about healthcare. You can read hundreds of articles out there that would explain that even things that we all know, heart disease is what kills most women. And one of the number one reasons it kills women is because we've never studied women's bodies. We are not men. We are built differently. We are built to have children. We are built with different organs. We are a species that is how we continue. And yet we have never been studied. No one's considered our experience, whether our veins are smaller than a male's, whether that means that we clot differently. And that's simple stuff. I mean, this is simple stuff that you would think we've been worrying and wringing our hands about the mystery of why women die from heart disease, and yet we still don't study women. And so I think when you look at these economic things, what the Women's Fund, we took on as our mantle, when we were founded 20 years ago, we wanted to know why women weren't reaching their full potential. And we've determined through a number of research projects over the years that it is these norms, these biases that are built into our society, our failure to consider other people's experiences. We cannot help that our country, our world was built on a white male experience. But we don't have to continue that, and we shouldn't. I have worked in philanthropy now for a number of years, and I can tell you that every time I meet a donor, they tell me they would like to fix poverty. And yet they don't at all consider the experience, the true experience of the people living in poverty. And to the points Christy was making, women, single women are by far and large the people living in poverty, and they are raising families in poverty. And yet we continue, just like we ignore those women's veins when we look at healthcare or heart disease, we look at poverty and we fail to consider the women's experience. And what they do with the children they have and their ability to take care of those children. And so if we don't challenge these gender norms that have never been challenged, if we don't challenge the implicit bias, the racism that continues to exist, we can't fix it. So we did study why women in Central Ohio what's the status of their wealth. And I want to make a really important point. We looked at wealth, not at wage, because wage is just a component of wealth. So there is data here about wage. But what I would say is that even before this started, if we go back to the let's see if we can go back a couple of slides. Let's see, is that the very first one that comes up? Mm-hmm. What I would say is that we know, let's go to the next one. So you can see that for the range here, and I want to make sure this is Central Ohio, but you can see Black women and Latino women are not making the same amount as even white women. And I can tell you that, of course, then there's still a delta when you consider that in the context of white men. Nationally, the numbers are actually even a little worse than they are in Central Ohio, and this was pre-COVID. So if we, but when you get to wealth, the important thing that you have to remember, so these are the national stats that we just put up here, and you can tell that Black women and Latino women make even a little less nationally than they do in Central Ohio. If we go on then to, this is where it gets really important. Nationally, and Central Ohio is right in line with what it is nationally. That first stat is the one that should, the first two stats should bring you to your knees. A single Black woman owns 2 cents to every dollar that a white single male owns. 2 cents. And this is what means, that means that that's because of the decelerators, all the things that Christy mentioned. They don't have childcare, reasonable, effective childcare options. We don't even consider it now coming out of this pandemic, how we're going to send these women back to work. We weren't doing a good job before. And now it is an absolute decelerator in this post. It was a decelerator before. Now it is a complete roadblock. Latina women, same thing, 8 cents to the dollar. All single women, just generally 40 cents is what they own. That means they don't have homes, that they lose their homes if their husband passes away because they've never accumulated wealth. They've never been taught or even contemplated. Society has not contemplated what happens when a woman has to live on her own. They just somehow believe we're taken care of. And I think that if you talk to most Black women and women of color, they would tell you that is not the case. And that no one is considering how to take care of them. And so this was pre-COVID. What I can tell you and what our other panelists have been saying is this is absolutely exacerbated by the COVID situation, and for all the reasons that Christy just mentioned. It is absolutely, I mean, to Christy and I, probably everyone's ears in town are ringing because both of us are insanely talking about childcare, because I think it's the one you should be able to grasp most easily. A lovely gentleman that I was talking to, working parent with a wife who's also a working parent, was on the phone with me recently telling me how difficult it is for him to get on the phone before noon because he's been trying to take care of his child and help the child with homeschooling in the morning. And he's really been worried about the fact that his coworkers don't think he's working hard enough and that he's not returning calls fast enough. And after taking a very deep breath, I said, now you know how working mothers have felt every day of our lives. Mm-hmm. And if he doesn't, the opportunity here, I don't know if I want to call it silver lining, but the opportunity here is to own that experience for our men, our single people who don't have children, to imagine what that experience is, to feel it and not forget it. Because if you don't forget it, we will change. But to Christy's point, if we just walked out and tried to walk out of our quarantine here and open things up, and the last thing we thought about was how working women were going to take care of their children, we've got a problem. Because women are not going to choose between the safety of their children and their job. Statistics have shown time and time again that they choose lesser. We don't choose lesser paying jobs. They choose us. Because we need the flexibility. We need to be able to make sure that we've taken care of our children. And if the jobs aren't providing the paid family leave, if they're not worried about where our childcare options are, if they're not realizing there's a business case that we will be better, more active parts of the economy if we know our children are safe, we're not going to solve this problem. So I think that, you know, what we know, if we flip ahead just a little bit is on the slides is that, and I won't run through this, I know you're going to make these available, but there are these barriers to wealth building for women. Student loan debt, they are often, women go to school, take out far too many student loans because they've been told by society that's how to get ahead, despite the fact that when they get their degree, there will be no childcare for that job that they have just gotten an education to get. Of course, the cost of childcare, lower wages, undervalued positions, a lack of capital and entrepreneurial spaces for women. All of these things are decelerators. On the flip side, all of those things could be accelerators. If you had women had safe and stable housing, if they had childcare options, if they had safe and affordable healthcare, and access to sexual education for their children, they would all of those things would accelerate instead of decelerate wealth among women. And it's wealth because we want them to have money for an emergency. We want them to not spiral into homelessness and all these other things just because their car breaks down. But that's where we were pre-COVID, and post-COVID, that's only been accelerated. So I think, again, I'm not sure, I'm just going to say with the slides, I think that what we know from COVID, there'll be some slides at the end that if any of you want to look through, because I don't want to take up too much time, but I mean, it's what you would imagine, that this is a she session. To that point, women they're either in jobs that are, that they've lost their jobs because they're the most undervalued jobs, the first hourly jobs to go, those sorts of things, or reverse side, they're essential workers who have been on the front lines without any of the stability pieces they need to take care of their children. And so we are sitting at bookends of either having lost everything or trying to actually hold our economy together. And it's remarkable. There was a headline the other day that you have to consider the fact that our economy is absolutely subsidized by women's unpaid work. The taking care of children, the taking care of elderly, all of those things that we are not paid for as a gender are the things that keep our economy going. And we cannot require women to subsidize that any longer. So I think that, you know, the news is that, you know, COVID has hit us hard. We are more unemployed than we've ever been before. We've probably wiped out about a decade worth of gains in the last month. That should trouble all of us. The tight employment market that existed pre-COVID was what was actually changing the world, because our employers needed women in their jobs and they were creating benefits for those women. And now that the market has shrunk, they're not going to, those are the first things that are going to go, is all the things they were doing to keep those women in the roles that they had, and what was actually helping to accelerate women's wealth slowly but surely even before this. You know, and the only thing I would say on the flip side is, though, you have to look at the fact that women leaders, not only nationally but internationally, have been incredibly effective. And that's because they are not risk averse. Everyone says women are risk averse. We are not. We are not reckless. And the risk here was to close and to take care of people at the right time. And the ones who did are succeeding. So let's change. One of the first definitions we can change is, what is risk? And I would venture to say that if we're willing to risk on these women, they stand ready and waiting to be active parts of this economy. And we've never, ever considered that. So as a culture, if we use this to consider that and we don't forget it just because restaurants are open, we actually have an unprecedented opportunity to change the face of our economy.
Yeah, I love your focus on this being an opportunity to rebuild and really rethink about what we want to create in the future. And this is an opportunity to do that. I mean, we have that pause to be able to really reflect and make change. Michael, I want to get your perspective, and then I do want to open it up to some questions from our participants today. But I want to get your perspective, particularly around, kind of what I said at the beginning, that AFCPE professionals are really well equipped and unique in the field of financial services at large in terms of that connection to the expertise and the empathy. And really, because so often you all are on the front lines of working with people who are struggling with financial security, and as we've already said, that's so foundational to everything else that we think about when we think about building a healthy country and society at large. What are your thoughts, I guess, even in terms of takeaways for our professionals here in looking at how we maybe see our clients differently, see ourselves differently to be able to work with clients differently? So what are some of your perspectives on that?
Yeah, well, first up, just want to commend everyone who's already spoken and are bringing forth very real issues that quite literally are the backbone of this country. Let's just be honest. I mean, if we don't have women who are thriving, then ultimately we don't have children who are thriving. If we don't have children who are thriving, then we don't have a thriving nation, a thriving community, a thriving society. So it is incredibly disheartening to look at a lot of these numbers and to even suggest that we uphold women and motherhood and Mother's Days and all these other different things. But yet that does not translate to the business side of it, to the monetary side of it, to financial health and well-being that's both sustainable now and in the foreseeable future. So again, I commend you all for doing the great work that you're doing. And I think that for individuals who are practitioners who are watching this, I think that one of the things that it's very easy to do is to stay within our comfort zone as it relates to how we try to serve clients. But what I found over the years is that you can't really serve a client comfortably. Like that's never really been my experience. If I'm really working with a client and I really understand the context of their situation and these many barriers that are in the way from the big goal that we're trying to achieve, there is nothing comfortable about helping an individual navigate that process. And there aren't many individuals, I'd be honest with you, who have the capacity to get in the trenches with their clients to see what they see from the vantage point that their clients see it. And then to think from there, well, if I'm in this position, how do I see myself out of it? And literally that's my approach when I work with clients. It's like, all right, I might not come from where you come from, but take me there. And I want to place myself literally as best as I can in your shoes and say, if I don't have the resources, if I don't have the family support, if I don't have X, Y, and Z, how would I then begin to see my way out of something? And there have been times where I haven't been able to see myself out of it. And that's if you haven't had that moment as a financial professional, when you get a chance to step outside of your privilege, your education, your background, your social connections and networks and ties, there are people who are literally in situations where if you were literally in that place without everything that you have, you would not be able to work out of it as easily as you think that you would be able to. That's called hot and cold empathy bias. There are different states, right? We can't empathize with ourselves in a position because we can't see ourselves in a position and we don't know how we would respond in the event that we are in said position, right? We can say what we would do, but unless we are actually in that position, we have no earthly idea how we would effectively navigate it. But I think that therein lies the possibility for solutions. And one of the things that I really pride myself on is that I just don't consider myself to be someone who's an advocate for financial literacy, financial capability, financial skill, or whatever financial umbrella we want to place it in. I really look at myself as being a financial advocate because I know if we're looking at systems, we can't just address behavioral things, because behavioral things, if we're thinking about systems theory and how there are all these different parts and the way that these parts interconnect and cause friction against one another, it has an impact on another part that has an impact on another part. and then another part that leads to a ultimate reality or result or whatever it may be. So being rooted in that lens, I understand that part of my role is to educate individuals, but then another part of my role is to partner with these ladies who are here and asking them and not sharing my expertise, but saying, hey, what are you seeing? What are the problems? And how can I be a part of the solution beyond just working with individuals on the ground level? Because this is the issue. If all I do is educate individuals and we have stuff that continually is rolling downhill from year to year, that means that my education is going to have to change year to year, whether it's the Jobs Cut and Tax Creation Act, right? Whether it's CARES Act, whether it's this act, whether it's this new law change, whether it's this new thing or that new thing, whatever. There's a never ending amount of education that has to be done over somebody's life cycle to help prevent them from stepping into the next mess that came on downhill. And what I'm realizing is that my work has to be done here, and it also has to be done up here to do some things preventively to keep things from rolling downhill, so that individuals aren't so overwhelmed with navigating obstacle after obstacle after obstacle, because I just helped you work through one thing that you're just now getting comfortable with, and you don't really have the capacity, the time, and the energy to get comfortable with anything else, right? And you're telling me there's this another thing that I have to worry about, and there's this other thing, and that's not even on top of a financial shock, which is what we're experiencing now. Is what we experienced in 2008, 2009, 2010. And one of the things that I don't think that we speak on enough is that our measures as a society for just general health of our economy is off. The stock market is not the best indicator to dictate whether or not we are in a position that in the event that we're gonna have a financial shock, which we are every 10 or 12 years or so, that companies, which a lot of them are doing what right now? They're going bankrupt. I wonder why. Right? We have this amazing, we've been on this amazing ride, but yet, as soon as we have a little bit of shock and disturbance, you're telling me now that businesses are lining up to file Chapter 11. So the issue is that we're not even really touching on the issue, which is incredibly unfortunate. But in thinking about systems, I would just advocate for practitioners to really do more listening than speaking, because the canned financial response isn't the best financial response. Everybody knows the canned recommendation. I know I need a budget. But how do you budget bringing home maybe $500, $600 every 2 weeks? I've already cut out my expenses. But then we make the assumption that these people are not already cutting expenses. But that's because you don't work with people, which is interesting to me, because we label people what we want to label people, and we put everybody in the same box, and we provide no context to their situation. We don't want to understand the systems. We don't want to understand environment, because we don't want to be uncomfortable. So if you're really serving people and you've never had a moment where you were uncomfortable in the process of someone else's discomfort, I would really challenge whether or not you've really tapped in what service really is. So if you are a practitioner, I just want to challenge you to get uncomfortable, because these solutions aren't easy. And these solutions aren't just say, I'm going to do a virtual session with somebody and I did my part for the day, right? Because, all right, I gave them information, but then now I need to be thinking about how am I addressing systems so that person can apply that information, right, in a system that's going to be optimal for their viability and their financial well-being, sustainably, long-term health. And unless we can provide that and really get in the trenches with our clients, I just don't see, it's so easy to say these are the issues. What I've realized is that some people just have to step up and say, I know nobody else wants to deal with the mess, but I'm going to be the one to do it. And the ladies who are on here are already doing that. We need more of that. The financial information is great. Providing people with knowledge is great. But at the end of the day, if that information doesn't hold a whole lot of weight in the context of your situation, then there's dissonance. Yep. And if there's dissonance, then there's a likelihood that you're not going to do that thing consistent enough and long enough to actually see it play itself out in a favorable way. So I would just encourage practitioners, don't do the work that we're doing in isolation. Get out into your communities, figure out who are the people who are moving and shaking and whatever it may be. And don't worry about being the person who's the next big person to blow. I'm not trying to be the next Dave Ramsey. I don't want to be the next Clark Howard. Honestly, at the end of the day, I won't even be remembered for half the work that I do. I just want to see real change. And I think if we get to that point and not worry about and fret about also who's getting the glory or who's getting the praise for this or that or the other, I think it opens us up to work with other agencies and organizations and to really try to make a good footprint of change while we have the time to do it. So that would be my call to action for practitioners.
Thank you. Thank you so much. It's really great words to end on. So I know we only have a couple minutes left, and I do want to get to some questions that are in there. Summer, I'll turn it over to you. I think you're monitoring the questions that have come in, and we can shoot them over to the panel.
Okay, a couple of things. First, the AFCPE completion code only applies to you if you are actually certified by AFCPE, but it is LENS 2020. That's LENS 2020, LENS 2020. Rebecca, did you want to talk about the DEI toolkit, or do you want to save that for later?
Yeah, I'm going to actually add a slide with some of the resources that have come up, but I did Slack in the chat the link to Michael's TED Talk on financial empathy. The AFCPE Diversity, Equity, and Inclusion Task Force has created a toolkit of some resources, so I want you to have access to that. And then for anyone on the call who does not know, we are currently offering free virtual counseling and coaching services with our certified professionals. And so I have a link to that as well, but I will put that on the slides and those will go out to everyone who registered for today as well.
Thank you. Okay, first question. What are some solutions for individuals and for employers during COVID-19 that can alleviate barriers for women?
Kelly, we're going to give that to you.
Sure. I think the first step is that for those of you who are numbers people, help us make the business case. This isn't about, I firmly believe in empathy, but for many people, the business case is going to help them along. And the bottom line is that there's some pretty simple math here that would tell companies that when you do actually invest upfront in some of these things that we've been talking about, the childcare, the paid family leave, you will actually make more money in the end. So if you're encouraging families or people who have businesses, how to run their small businesses, and I know because I talk to people all the time, and many, even women, small business owners say, I understand we need paid leave, but I can't do that. My business is too small. I would make a business argument, think through the math, that actually investing in that paid leave and not being so afraid of it, you will make more money on the other end when people aren't just flaking and not coming to work or are quitting, or you're retraining people all the time. So that's a broad solution, but I would say as people who are good business thinkers and can think through the finance side of it, make the business case. Help us make the business case.
And Kelly, I actually think that the empathy is in the business case. Because like you said, if we understand that the barrier for the business owner is financial viability, then you approach that from that empathetic lens. I understand where you are coming from. Therefore, when I create this solution, I don't discredit the way you feel. I say, hey, this is where we are. However, based on the information and the numbers that we see, you could actually be in a better position if you do said thing. And that's where I think that we lose empathy. Empathy isn't just this shared collective, I just get you, I understand you. It's I understand you enough to understand what the barrier is in your situation. And if I understand your barrier, then I could proactively create a solution where you feel heard. I don't know anybody from a business lens, and you know this, you raise money all the time. If you're speaking with someone and they're balking on the idea of making a gift, and you say, what is it? You're like, well, it's timing. I have this going on. Well, you know what? You don't have to do it all at one time, right? I hear you. This person hears me. So I think that I absolutely agree with making the business case. But don't make the business case in such a way where we're doing it on polar extremes, right? Because I'm so pumped up and wanting to serve women, or underserved populations or whatever it may be, that I forget to think about the person who is also a clog in this process that needs to help or assist or to facilitate this happening and being sustainable. So I completely agree with the point. But when I say empathy, what I'm saying is that I understand where this person is coming from, and I'm creating a solution that's a win-win solution, that that person feels heard, and they also understand the needs of the people that I'm trying to support as well.
Great. Yeah, no, great point. Great point. Because I would say, instead of trying to make them live inside the head of someone they don't understand, to your earlier point, try to help them understand how it affects them. And so I think actually we're saying very similar things, and I appreciate your point, because I'm actually probably thinking more of the word emotional than empathetic. And so that's a good call out, and I appreciate it.
One of the things, Rebecca, I think employers can do, and this was something that we were getting ready to pilot before COVID hit, we're going to be picking back up, is I think that as employers, we're often, adding all the tools. When you think about financial planning, right, it's not just, a 401k, a bank account, a retirement fund, but it's also insurance and some of those other pieces. And I think as employers, when we put together benefit packages, I think access to financial planning is actually one of the tools that we can try and put in front of our employees in a way that is non-threatening, that is seen as an added benefit in how to use some of the things that we're, the insurance and the other things that we're putting in front of them, how to make some of those things go to work for them, how to make money on some of those things, how to get to retirement, or how to, appropriately, how to save if savings is a question, how to increase a credit score if that's a problem. I think some of those tools, if we as employers can start to, even working with organizations like AFCPE, to put those tools in the hands of our employees, especially, those, all employees, but especially women and people of color who may not have had access to some of those tools, so that they can start to build wealth and figure out, what works for them and their households. We would be providing a great service to our employees, along with the other benefits that Kelly mentioned in terms of the paid leave and, access to childcare and those kinds of things. A full basket of services that allow someone to take in, their financial health in their control.
Yeah, absolutely. I know we're just a couple minutes over, and I just want to say thank you so much to each of you on the panel for taking the time today. I learned a great deal. I'm challenged both, from the individual and systemic perspective to kind of think about what my role is, what I can do differently, how we can better partner, as you said, Christy, and really make this much more widespread. I think this is the key. This is what our professionals do so well. As I said at the beginning, they're highly trained, but they bring that level of empathy to go deeper into all of these compounding complexities that money bring to all of our lives, really. And then you layer on racism and gender bias and all this other stuff. So that's why I love this organization so much, and am so proud of our professionals, because they are so passionate about these issues. And I'm just excited about, taking that sort of charge and call to action for what each of us can do and how we can work more collectively to change some of these things. And as you said, Kelly, it's an opportunity. So I think, there was so much information today. We will send out the slides. I will include those resources. If people are looking for that type of qualified financial guidance for folks who are struggling, even if they were struggling before COVID, we are offering that free right now with a grant by Wells Fargo Foundation. And so we really want people to take advantage of this opportunity to start building financial security. Thank you so much, Christy, Kelly, Michael, and to Liz as well, who I know has already been hopped off, but I appreciate all of your time and expertise. This was really fabulous today. I appreciate each of you. And thanks so much for everybody for joining today.
Thank you.
Thank you.
Be well.
Be well.
Thank you, and have a wonderful day, everyone.
Mm-hmm.